Hello, I'm Maria Garcia, licensed massage and bodywork therapist. Today I'm gonna talk about custom massage and bodywork therapy sessions. So a custom massage and bodywork therapy session goes beyond just massage, which is the manipulation of soft tissue. So aside from using massage, I'm also using supporting therapies and a multitude of modalities to really get down to what you need to help you with your neuromuscular issues. So I can go into detail about every modality, but I will probably just make another video about that. But with the custom massage and bodywork therapy session, you'll be able to add multiple therapies. I only charge per time. Every therapist is different though. Most places they charge per therapy and per time. I only charge per time because I don't want my clients to worry about having to add these therapies that they might or might not be able to afford. I also believe that it is my job to create the sessions that are the most beneficial for the client while relieving stress. And that includes mental stress of thinking, I only brought enough for this, I didn't bring enough for that. That's why I only charge per time. And I could talk about the modalities later, but today I'm mostly going to talk about the supporting therapies. And people who know me know that I'm a big fan of percussion, so I'll use percussion, and I have a video talking about that, so you could look through my channel and find that. Look for percussion for massage therapy, and it discusses the benefits of percussion. So the vibration of the percussion is going to release tension on a deeper part, like the deeper side of the muscles, so it goes multiple layers. It's very beneficial as well because it brings new blood flow to the area. So I always recommend to do that, especially right after working out or even right before sleep. Another supportive therapy is hot bamboo. So any type of heat is going to help remove any tension. An added benefit to bamboo is just the shape of it itself creates so much pressure that it allows for a deeper release. And this is good for the therapist as well, because my hands are like this, the most I can do is, use my knuckles. And it's still a pretty big area. Well, this is a smaller area, so it's going to reach those smaller and harder to reach muscles. That creates a lot more resistance, a lot more pressure. One of my favorite ones is cupping as well. So for cupping, the benefits of cupping is that it will lift the muscle, and when it places it back down, it'll place it back to its original position where it should be. It'll also remove any stagnant blood, so it'll bring back the pliability in the muscle. And sometimes that might take a lot of sessions because some people will let their muscles get rock hard. But cupping is one of the more intense therapies that really work, that really help out a lot with that. So you'll see the most results with cupping, and it's very nice because you almost see it instantly. You'll see the bruising, and that's gonna let you know how much stagnant blood, like how bad that muscle was. And then we have, of course, different forms of stones. So we got like your regular black stones, and those will retain a lot of heat. Now, energetically speaking, they can also remove negative energy. They'll retain a lot of heat, they'll remove a lot of tension. And then you have the Himalayan stones, and those are the opposite. So those are really good for like the heart chakra. Also, due to the texture of the Himalayan stones, I don't bring any to my practice, but I have used them in spas. But another benefit to the Himalayan ones is that they reduce inflammation, and due to the texture, they also are very exfoliating. A few others are cryotherapy. So I like to use cryotherapy a lot for injuries. So for an injury, for example, I would use heat to help the muscle warm up, bring some blood flow, bring some pliability in there. Then if the injury is allowing for it without it hurting, I would definitely go in with percussion as well. Once all of that is nice and done and you don't want any inflammation, then we would go in with some with some cryotherapy, with some ice packs. So that's what the cold is good for. Like, cryotherapy is really good for inflammation, and it's really good for reducing pain, and decreasing sensitivity as well. So those are the only ones that I use. I also use muscle rubs. So CBD is one that I am a big fan of. A lot of people are under the impression that CBD has THC. It does not. It does not have THC. So for people who might not have a lot of pain or just have very low tolerance, they might do something like 100 milligrams. If I'm doing a basic massage and just basic tension relief, the person isn't in any type of pain, like horrible pain, just a little bit maybe, then you stick with 50 to 100 milligrams. Now, if you experience a lot of pain, or you have a pretty high tolerance towards like pain stuff, so I would use anywhere from like 500 to like 1,000. That's where you'll get the most results. And you would place like something with that much milligrams, you would use that with an actual injury. So you wouldn't rub that all over the body. You would put that specifically on the area that is in pain, the area or the areas that are in pain. We also have arnica, of course, and that's a pretty helpful one. Emu oil is also one of the muscle rubs that I like to use. The lidocaine patches, of course, those two. I don't have the lidocaine patches now, but I do recommend, if you do get them from your chiropractor, to use them, of course. And those are some of the therapies. I think in the next video we can talk about the modalities, how you can create a good custom massage and bodywork therapy session for yourself. But when you come to my practice, you don't have to know everything or anything, really. If you book a consultation or even just an appointment, we could talk about your neuromuscular needs. We could talk about what modality is the one that's best for you. And we can also talk about supporting therapies. So that's pretty much it for today. If you have any questions, leave them in the comments. Hit me up on one of my socials. I'm somechick17 on Instagram. And I believe I'm also somechick17 on Facebook. So thank you very much, and I hope that you guys learned something today.